Hello everyone, good morning. Let's talk about medial medullary syndrome. In medial medullary syndrome, that is medial part of the medulla, what is supplied by the medial part of the medulla? The medial part of the medulla is supplied by the anterior spinal artery. Anterior spinal artery. From where does the anterior spinal artery arise? The anterior spinal artery arises from the vertebral artery. This is the vertebral artery. Just at the bifurcation, it forms the anterior spinal artery. The vertebral artery will also give rise to the posterior inferior cerebellar artery. The anterior spinal artery supplies the medial part of the medulla, while the posterior inferior cerebellar artery, pica, supplies the lateral part of the medulla. Let's see about the symptoms. Medulla is the one which houses the 9, 10, 11 and 12th cranial nerve nuclei. So, the 3 and 4 are present in the midbrain. 5, 6, 7, 8. 5 is the largest cranial nerve nuclei. So, it covers more than 2 structures. We can talk about it in another video. 6, 7, 8 are pertaining to pons. 9, 10, 11 and 12 are the one which are present in the medulla. Out of this, the 12th cranial nerve is present in the medial part, but whereas 9 and 10 is present in the lateral part. So, the anterior spinal artery infarction will cause infarction of the 12th cranial nerve nuclei too. Therefore, the hypoglossal nerve, which is the 12th cranial nerve, is also affected. When that side 12th cranial nerve is affected, it will result in an ipsilateral tongue deviation. So, this is the presentation for medial medullary syndrome. If you ask me what happens in the lateral medullary syndrome, that is the lateral part of the medulla, you need to remember 2 important structures. One is the sympathetic impulses are travelled in the lateral part of the medulla. The second one is the 9 and 10th cranial nerve, that is the glossopharyngeal as well as the vagus, which are the most important cranial nerves or the nuclei for swallowing. So, therefore, when the lateral medulla is affected, which is caused by the infarction of the pica, that is posterior inferior cerebellar artery, then we have the lateral medullary syndrome. It is also known as Wallenberg syndrome. The 2 important structures are the sympathetic chain, therefore it presents with Horner syndrome, and the second one is the 9 and 10th cranial nerves, therefore it presents with dysphagia. So, this is what happens in the lateral medullary syndrome, and this is what happens in the medial medullary syndrome. As a continuation to it, I will tell you what happens in the lateral pontine syndrome. Lateral pons is supplied by anterior inferior cerebellar artery. What is the cranial nerve present? The most important cranial nerve is the 7th cranial nerve. So, when anterior inferior cerebellar artery is affected, then the 7th cranial nerve palsy happens, that is Bell's palsy happens. There is a clue to remember this. AICA, that is anterior inferior cerebellar artery, lateral pons. When it is affected, then FACIAL, facial palsy happens. So, if you scramble the letters or if you rearrange the letters, then they are almost similar. So, this is a way to mnemonic to remember it. This is in short about medial medullary syndrome, lateral medullary syndrome as well as the lateral pontine syndrome. Thank you for listening all this while. I wish you all the best for your exams.